In the complex world of sexual and reproductive health, certain infections remain largely under-recognized by the general public. While many are familiar with common sexually transmitted infections, STIs, such as chlamydia, gonorrhea, syphilis, and HIV, other bacterial infections, like Fusobacterium genital infection, are often overlooked. Despite its low profile, Fusobacterium infection can have significant implications for reproductive and genital health if left undiagnosed or untreated. Fusobacterium is a genus of anaerobic, gram-negative bacteria that normally inhabit the human oral cavity, gastrointestinal tract, and, in some cases, the genital tract. These bacteria generally live harmlessly within the body. However, when they migrate to areas of vulnerability or when the natural balance of microbiota is disrupted, they can cause infections in the genital and pelvic region, leading to inflammation, discomfort, and serious complications. In this WUTNews in-depth health awareness video, we will explore everything about Fusobacterium genital infection. This includes the history of Fusobacterium, how the infection occurs, modes of transmission, global prevalence, symptoms in both men and women, diagnosis, treatment methods, prevention strategies, and protective measures. By understanding this infection, viewers will gain the knowledge needed to recognize symptoms early, seek medical care promptly, and protect reproductive health. If you are committed to improving your understanding of rare and lesser-known genital infections, make sure to subscribe to WUTNews and turn on notifications. This channel provides reliable information on sexual health, rare infections, medical awareness, and global health updates. Understanding Fusobacteria bacteria. Fusobacterium is a genus of strict anaerobic gram-negative bacilli. These bacteria are normally present in the human mouth, gut, and lower genital tract, where they contribute to normal microbiota function. Under typical conditions, Fusobacteria species coexist harmlessly with other microorganisms. However, these bacteria are opportunistic pathogens, which means that under certain conditions, they can cause disease in the genital and pelvic region. The most commonly implicated species in human infections are Fusobacterium nucleatum, Fusobacterium necrophorum, Fusobacterium periodonticum. Although these bacteria are usually associated with oral and gastrointestinal infections, genital infections have been reported, particularly in immunocompromised individuals or those with disrupted genital microbiota. Historical background. Fusobacterium was first identified in the late 19th century by microbiologists studying anaerobic bacteria in human abscesses. Initially, these bacteria were primarily associated with oral and dental infections, including periodontitis and tonsillitis. By the mid-20th century, researchers began documenting Fusobacterium in intra-abdominal, pelvic, and genital infections, often in combination with other anaerobic bacteria. These studies revealed that Fusobacterium could play a significant role in pelvic inflammatory disease, postpartum infections, and sexually associated infections, though its involvement was frequently underdiagnosed due to the difficulty in culturing strict anaerobes. How Fusobacterium causes genital infection. Fusobacterium genital infection occurs when normal protective barriers of the genital tract are compromised. A delicate balance of vaginal or urethral microbiota prevents harmful bacteria from overgrowing. When this balance is disrupted, Fusobacteria can multiply and invade tissues, causing infection. Triggering factors: disruption of normal genital microbiota due to antibiotics, poor genital hygiene, hormonal changes during pregnancy, postpartum, or menopause, immunosuppression, HIV, chemotherapy, chronic illness, surgical procedures including gynecological or urological interventions, childbirth, miscarriage, or postpartum complications, chronic diseases like diabetes. Once these conditions are present, Fusobacteria bacteria can trigger inflammation, abscess formation, and systemic complications if left untreated. Transmission and contagion. Unlike typical sexually transmitted infections, Fusobacterium genital infections are primarily endogenous, meaning they arise from bacteria already present in the individual's body. However, sexual activity can sometimes contribute indirectly by altering the balance of genital microbiota, introducing microtrauma to genital tissues, facilitating bacterial migration to vulnerability areas. Direct person-to-person sexual transmission is rare, but poor genital hygiene, unprotected sex, and contaminated medical instruments may increase risk. Symptoms of Fusobacterium genital infection. Symptoms vary depending on gender, severity, and whether the infection has spread beyond the local genital area. General symptoms: genital discomfort or pain, foul-smelling discharge from the genital tract, redness and swelling, burning sensation during urination, lower abdominal or pelvic pain. Symptoms in women: vaginal discharge with unusual odor, pain during intercourse, pelvic inflammatory disease PID, fever and malaise and severe infections. Symptoms in men: urethral discomfort or irritation, mild discharge, pressure or pain in the genital region.
Some individuals may remain asymptomatic, which can allow the infection to progress unnoticed. Complications of untreated infection. Untreated Fusobacterium genital infection can lead to pelvic inflammatory disease (PID) in women, infertility or pregnancy complications, abscess formation in the genital or pelvic area, systemic infection if bacteria enter the bloodstream, chronic genital discomfort and recurrent infections. Early detection and treatment are crucial to avoid these complications. Global prevalence. Fusobacterium genital infections are reported worldwide, as Fusobacteria species naturally reside in the human body. However, higher documented cases occur in regions with limited access to healthcare, high prevalence of bacterial dysbiosis, postpartum or post-surgical complications. Developed countries often report more cases due to advanced diagnostic capabilities. Diagnosis. Diagnosis of Fusobacterium genital infection requires clinical examination and patient history, microbiological cultures under strict anaerobic conditions, microscopy to identify bacterial morphology, imaging for suspected abscess formation or severe pelvic infection. Accurate diagnosis can be challenging due to the anaerobic nature of Fusobacterium, which makes laboratory culturing difficult. Treatment options. Treatment primarily involves antibiotics that target anaerobic bacteria. Common approaches include metronidazole, beta-lactam/beta-lactamase inhibitor combinations, supportive care for symptoms, abscess drainage or surgical intervention in severe cases. Addressing underlying conditions, such as restoring healthy genital microbiota and improving hygiene, is essential to prevent recurrence. Prevention strategies. Preventing Fusobacterium genital infection involves maintaining genital health and reducing risk factors. Practice good genital hygiene, avoid unnecessary antibiotics, safe sexual practices, regular gynecological and urological checkups. Support immune health with proper diet, exercise, and stress management. Raising awareness is critical, as many infections are asymptomatic or misdiagnosed, which can delay treatment. Why awareness matters. Fusobacterium genital infection, though rare, can have significant reproductive and pelvic health consequences if ignored. By understanding its causes, symptoms, and prevention strategies, individuals can recognize early symptoms, seek medical care promptly, protect reproductive health, reduce the risk of chronic or systemic complications. Final words from WUTNews. Fusobacterium genital infection may be less known, but it is a potentially serious health threat. Awareness and education empower people to take preventive measures and seek timely treatment. Alexis, subscribe to WUTNews for regular updates on sexual and reproductive health, rare infections and STIs, global health awareness, medical education and health tips. Like, share, and comment to help others stay informed and protect their reproductive health. Stay safe, stay informed, and stay healthy with WUTNews.